Hello everyone, now let us discuss about CPT coding guidelines for surgery, musculoskeletal system part 1. So here we will be discussing about the various guidelines regarding the musculoskeletal system. So all services that appear in the musculoskeletal system section include the application and removal of the first cast, splint or traction device whenever performed. Supplies may be reported separately. If the cast is removed by some other physician or other qualified healthcare professional who applied the cast, report a cast removal code separately. Whenever cast is removed by some other physician or other qualified healthcare professional, then you need to report the cast removal code. Next, subsequent replacement of cast, splint or trapping or traction device during or after the global period may be reported separately. And if a cast, splint or strapping is not considered part of preoperative care, the use of modifier 56 for preoperative management only is not applicable. Whenever cast, splint or strapping is not considered the part of preoperative care, therefore, use of modifier 56 per preoperative management only is not applicable in this case. Next, coming to codes for obtaining autogenous bone grafts, cartilage, tendon, fascia lata grafts or other tissues through separate incisions are to be used only when graft is not already listed as part of basic procedure. The codes for obtaining the bone grafts or cartilage or tendon or fascia lata grafts or other tissues through separate incisions are to be used only when the graft is not already listed as a part of basic procedure. In general, the graft will be listed as a part of basic procedure. Whenever it is not listed as a part of basic procedure, then the codes for obtaining grafts should be coded separately. Now coming to fracture and or dislocation treatment. Fracture and dislocation treatment code appear throughout the musculoskeletal system section. The fracture and dislocation codes, they appear throughout the musculoskeletal system. These codes are categorized by treatment, whether it is closed, percutaneous or open, and by type of stabilization. The fracture codes are categorized by type of treatment and type of stabilization, whether it is fixation or immobilization. There is no coding correlation between the type of fracture or dislocation and the type of treatment. For example, a closed fracture may have an open treatment. So there is no correlation between the type of fracture and type of treatment. Coming to manipulation. Manipulation is nothing but reduction by application of manually applied forces or traction to achieve satisfactory alignment of fracture or dislocation. If satisfactory alignment is not maintained or required subsequent re-reduction of the fracture or dislocation by the same physician or same qualified healthcare professional, then we need to append modifier 76 to fracture dislocation or treatment code. Coming to traction, the application of distracting or traction force to the spine or a limb. Skeletal traction includes wire, pin, screw or clamp that is attached to bone. Skin traction is the application of force to a limb using strapping or a device that is applied directly to the skin only. So in traction there are two types, skeleton traction and skin traction. Coming to closed treatment. In closed treatment, the treatment site is not surgically open, that is not exposed to external environment or directly visualized. Closed treatment of fracture or dislocation may be performed without manipulation or with manipulation, with skeletal traction and or with skin traction. Casting, splinting or strapping used slowly for temporarily stabilize the fracture for patient comfort is not considered as closed treatment. The casting, splinting or stamping that is solely used to temporarily stabilize the fracture for patient comfort is not considered as closed treatment. Coming to percutaneous skeletal fixation. Here, the treatment that is neither opened or closed. Percutaneous skeletal fixation is neither opened or closed. In this procedure, the fracture fragments are not visualized, but fixation is placed across the fracture site, typically with imaging guidance. Now coming to open treatment or open treatment. The site is opened surgically to expose the fracture or dislocation to external environment for treatment, or the fracture or dislocation is treated through the traumatic wound or an excision thereof is treated with an intramedullary nail or other internal fixation device placed through a surgical exposure that is remote from the fracture site, with or without direct visualization of the fracture site. In simple words, in open treatment, the site is surgically opened and majority of the cases an internal fixation device is placed through a surgical exposure that is remote from the fracture site, with or without visualization of the fracture site. Coming to external fixation. Use of pins or wires that penetrates the bone and interconnection devices, for example clamps, bars and rings, for fracture or dislocation treatment is called as external fixation. It may be used temporarily or for long-term fracture treatment. Uniplanar external fixation places all pins in approximately the same plane, hence the plane uniplanar, that is one plane, but may also include triangular fixation across the joint. Now coming to multiplanar external fixation, it uses transosseous wires and threaded pins placed in several places that are held with interconnected stabilizing or tensioning rings and or half rings. Multiplanar external fixation device, it uses osseous wires and threaded pins that are placed in several planes. External fixation may be used for all types of fracture or dislocation, that is for closed, percutaneous or open. Next are codes for external fixation are reported separately only when external fixation is not listed in the code descriptor as inherent to the procedure. Coming to reporting fracture and dislocation treatment codes. Physician or other qualified healthcare professional providing fracture or dislocation treatment should report the appropriate fracture or dislocation treatment codes for the services he or she provided. If the person providing the initial treatment will not be providing the subsequent treatment, modifier 54 should be appended to the fracture or dislocation treatment codes. And if the treatment of fracture as defined above is not performed, report an evaluation and management code. If in some cases if the treatment as defined above is not performed, then you can provide an E&M code. And if a person providing the initial treatment is not, some other person or some other physician is providing the subsequent treatment, modifier 54 should be appended to the fracture or dislocation treatment codes. Let us discuss about excision or resection of soft tissue tumors definitions. Excision of subcutaneous soft connective tissue tumors. So the excision of subcutaneous soft connective tissue tumors, it includes simple or intermediate repair. That is, whenever simple or intermediate is repair is performed, that is included. And this excision usually involves the simple or marginal resection of tumors confined to subcutaneous tissue below the skin, but not above the deep fascia. And these tumors are usually benign and resected without removing a significant amount of the surrounding normal tissue. Code selection is based upon the location and size of the tumor. And the code selection is determined by measuring the greatest diameter of the tumor plus the margins required for complete excision of the tumor. And the margins refer to the most narrow margins required to adequately excise the tumor based on physician's judgment. And the measurement of tumor plus margin is made at the time of excision. Appreciable vessel exploration and or neuroplasty should be reported separately. This is important point. Appreciable vessel exploration and or neuroplasty should be reported separately. Coming to extensive undermining or other techniques to close a defect created by skin excision may require a complex repair which should be reported separately. Whenever extensive undermining or other techniques are performed to close a defect created by skin excision, this may require complex repair which must be reported separately. And the dissection or elevation of tissue planes to permit the resection of the tumor is included in the excision itself. For excision of benign lesions of cutaneous origin, you need to refer codes in the series 11400 to 11446. Coming to excision of facial or subfacial soft tissue tumors. This also includes the simple and intermediate repair, involves the resection of tumors confined to the tissue within or below the deep fascia but not involving the bone. These tumors are usually benign and offer intramuscular and are resected without removing a significant amount of surrounding normal tissue. And like any excision, code selection is based upon the size and location of the tumor, and it is determined by measuring the greatest diameter of the tumor plus the narrowest margins required for complete excision of the tumor. The measurement of tumor plus margin is made at the time of excision. Similar to that of the previous one, appreciable vessel exploration and or neuroplasty whenever performed should be reported separately. In addition to that, whenever complex repair involving extensive undermining or other techniques to close the defect, whenever it is done, it must be reported separately. Whereas the dissection or elevation of tissue planes to permit the resection of the tumor is included in the excision. Digital, that is belonging to fingers and toes, digits. Digital subfacial tumors are defined as those tumors involving the tendons, tendon sheets or joints of the digits. Tumors which are simple but do not breach the tendon sheet or joint capsule are considered as subcutaneous soft tissue tumors. Now coming to radical resection of soft tissue tumors. It also includes simple or intermediate repair, and it involves the resection of tumor with wide margins of normal tissue. Radical resection involves the resection of tumor with wide margins of normal tissue. Appreciable vessel exploration and or neuroplasty repair or reconstruction should be reported separately. Complex repair to close the defect should be reported separately, whereas dissection or elevation of the tissue planes to permit resection is included. Although these tumors may be confined to specific layer, for example, subcutaneous, subfacial, radical resection may involve removal of tissue from one or more layers. This is important point. Radical resection may involve removal of tissue from one or more layers. And the radical resection of soft tissue tumors is most commonly used for malignant connective tissue tumors or very aggressive benign connective tissue tumors. Like any excision or resection, the code selection is based upon the size and location of the tumor, and the code selection is determined by measuring the greatest diameter, which includes the size of the tumor plus the narrowest margins that are required for complete excision of the tumor. And the measurement of tumor plus margin is made at the time of excision. For radical resection of tumor of cutaneous origin, we must see the codes 11600 to 11646. Now coming to radical resection of bone tumors, it also includes simple or intermediate repair, and it involves a resection of tumor with wide margin of normal tissue. Appreciable vessel exploration and neuroplasty and complex bone repair or reconstruction should be reported separately. Complex repair, as discussed earlier, which involves extensive undermining or other techniques to close a defect, should be reported separately, whereas dissection or elevation of tissue planes to permit the resection is included in radical resection, similar to that of excision. It may require removal of entire bone if tumor growth is extensive. Radical resection of bone tumors is usually performed for malignant tumors or very aggressive benign tumors. If surrounding soft tissue is removed during these procedures, the radical resection of soft tissue tumors code should not be reported separately. Code selection is based solely on the location of the tumor. Here there is little difference. The code selection is based solely on the location of the tumor, not on the size of the tumor or whether the tumor is benign or malignant or primary or metastatic. It is solely based on the location of the tumor. Coming to wound exploration resulting from penetrating trauma, for example, penetrating gunshot or stab wound. Codes are in the range 20100 to 20103, relate to wounds resulting from penetrating trauma. These codes describe the surgical exploration and enlargement of wound, extension of dissection to determine penetration, debridement, removal of foreign body, ligation or coagulation of minor subcutaneous or muscular blood vessel of the subcutaneous tissue, muscle, fascia and or muscle not requiring thoracotomy or laparotomy. If repair is done for major structure or major blood vessel requiring thoracotomy or laparotomy, then those specific codes would supersede the codes of 20100 to 20103. Usually the codes do not 20100 to 20103 which relate wound for penetrating trauma, they do not require or include thoracotomy or laparotomy. If a repair is done to major structure or major blood vessel requiring thoracotomy or laparotomy, these specific codes would supersede the codes 20100 to 20103. To repair simple, intermediate or complex repair of wound that do not require enlargement of the wound, extension or dissection, etc. as stated above, use specific repair codes from integumentary system. For simple repair or intermediate or complex repair of wound that will not require enlargement of wound or extension of dissection, then we must use specific repair codes that are reported in the integumentary system section. Now coming to the various CPTs. The first CPT is 20100, which is nothing but exploration of penetrating wound, separate procedure, neck. The next is 20101, exploration of penetrating wound, chest. 20102, exploration of penetrating wound, abdomen, flank or back. Next is 20103, exploration of penetrating wound, extremity. Now coming to excision codes. 20150, excision of epiphyseal bar with or without autogenous soft tissue graft obtained through same facial incision. The next is 20200, biopsy muscle superficial. The next is 20205, biopsy muscle deep. The next is 20206, biopsy muscle percutaneous needle. The next is 20220, 20220, biopsy bone, trocar or needle. Superficial. For example, ilium, sternum, spinous process, ribs. The next is 20220, biopsy bone deep. For example, vertebral body or femur. The next is 20240, biopsy bone open, superficial, which includes sternum, spinous process, ribs, patella, oleocranial process, calcaneus, tarsal, metatarsal, carpal, metacarpal, phalanx. The next is 20245, biopsy bone open deep, which involves humeral shaft in ischium, femoral shaft. The next is 20250, biopsy vertebral body open thoracic. The next is 20251, biopsy vertebral body open lumbar or cervical. Now let us discuss an example. A 63-year-old man sustained a gunshot wound through the right maxillary sinus that penetrated through the right neck. Here there is a penetrating gunshot wound that penetrated through the right neck. CT scan revealed no hard evidence of arterial injury, but a bullet was directed in line with the internal jugular vein. He was sent for operating room for neck exploration to rule out vascular injury and injury to aerodigestive tract. Select appropriate CPTs for this procedure. Here, neck exploration of wound. Location is neck. So the appropriate CPT is 20100. Exploration of penetrating wound, neck. Before going into further CPTs, let us discuss the definition of orthosynthesis or joint aspiration. Orthosynthesis or joint aspiration is a clinical procedure that is performed to diagnose and in some cases treat musculoskeletal condition. The root word orthos means joint, whereas kenthesis or synthesis means puncture. So puncture to joint. Orthosynthesis in simple words means puncture to joint. This procedure entails using a syringe to collect synovial fluid from or inject the medication into the joint capsule. The laboratory analysis of synovial fluid can further help characterize the diseased joint and distinguish between gout, arthritis, or synovial infections such as septic arthritis. Now the next definition is trigger point injections. So what are trigger point injections? The trigger point injections are pain management treatment that involves injecting a local anesthetic, sometimes combined with steroid medication, into a trigger point to relax muscles and relieve pain. So what is a trigger point? A trigger point is a tender area of muscle that develops when tissue surrounding the muscle called fascia or myofascia contracts and sticks to itself. A trigger point is often identified as a knot or bump under the skin that can cause pain in the area where it has developed. So in some cases, a trigger point can even cause pain in another area of the body when it affects a nearby nerve. This is called as referred pain. Now coming to the CPTs of introduction or removal. The first one is 20500. Injection of sinus tract therapeutic. The next is 20501. Injection of sinus tract diagnostic, which is nothing but sinogram. Next is 20520. Removal of foreign body in muscle or tendon sheet simple. The next is 20525. Removal of foreign body in muscle or tendon sheet deep or complicated. The next is 20526. Injection therapeutic agent. Local anesthetic corticosteroid into carpal tunnel. Injection therapeutic to carpal tunnel. 20526. The next is 20527. Injection enzyme for palmar fascia cord. Example, dupintrine contracture. The next is 20550. Injection single tendon sheet or ligament or aponeurosis. For example, plantar fascia. The next is 20551. Injection single tendon of origin or insertion. The next is 20552. Injection single or multiple trigger points, one or two muscles. The next is 20553. Injection single or multiple trigger points, one or more muscles. The next CPT is out of sequence numerical sequence, hence it is indicated by number sign. 20560. Needle insertion without injection, one or more muscles. The next is 20561. Needle insertion without injection, three or more muscles. The next is 20555. Placement of needle or catheters into muscles or soft tissue for subsequent interstitial radio element application. Next CPT is 20600. Orthosynthesis, aspiration or injection, small joint or bursa. For example, fingers and toes without ultrasound guidance. The next is 20604. Orthosynthesis or aspiration or injection, small joint or bursa with ultrasound guidance with permanent recording and reporting. The next is 20605. Orthosynthesis, aspiration and or injection, intermediate joint or bursa. For example, temporomandibular, acromoclavicular, wrist without ultrasound guidance. The next is 20606. Orthosynthesis or aspiration and or injection, intermediate joint or bursa with ultrasound guidance with permanent recording and reporting. The next is 20610. Orthosynthesis, aspiration and or injection, major joint or bursa. For example, shoulder, hip, knee, subacromial bursa without ultrasound guidance. The next is 20611. Orthosynthesis, aspiration or injection, major joint or bursa with ultrasound guidance with permanent recording or reporting. The next is 20612. Aspiration or injection of ganglionic cyst, any location. Now let us discuss an example. A 42-year-old with chronic right trochanteric bursitis is scheduled to receive an injection at the pain clinic. A 22-gauge spine needle is introduced into the trochanteric bursa and a total volume of 8 cc of normal saline and 40 mg of Kenalog was injected. The correct CPT to the procedure is 20610 with RT modifier, which indicates right side because chronic right trochanteric bursitis. 20610 indicates orthosynthesis, aspiration or injection, major joint or bursa. Example, shoulder, hip, knee, subacromial bursa without ultrasound guidance. Additionally, product code for drug should also be given. Now let us see one more example. A 27-year-old presents with right-sided thoracic myofascial pain. A 25-gauge 1.5-inch needle on a 10 cc controlled syringe with 0.5% bupivacaine was used. After negative aspiration, 2 cc was injected into each point. A total of 4 points, and 4 means 4 trigger points were injected. A total of 8 cc of bupivacaine was used on the rhomboid major, rhombic minor and levator scapula muscles. What code should be used for this procedure? Here 4 trigger points are identified. So the appropriate CPT is 20553. Injection, single or multiple trigger points, 3 or more muscles. Now let us discuss some more CPTs of introduction or removal. The first CPT is 20615, which involves aspiration and injection for treatment of bone cyst. The next is 20650. Insertion of wire or pin with application of skeletal traction including removal. The next is 20660. Application of cranial tongs, caliper or stereotactic frame including removal. Next is 20661. Application of halo including removal cranial. The next is 20662. Application of halo including removal pelvic. The next is 20663, which involves application of halo including removal femoral. The next is 20664, application of halo including removal cranial, 6 or more pins placed for thin skull osteology for pediatric patients and hydrocephalus and osteogenesis imperfecta. The next is 20665, removal of tongs of or halo applied by another individual. The next is 20670, removal of implant superficial. The next is 20680, removal of implant deep. The next is 20690, application of uniplanar unilateral external fixation system. The next is 20692, application of multiplanar unilateral external fixation system. Multiplanar but unilateral external fixation system. Example, Ilizaro Monticelli type. Next is 20693, adjustment or revision of external fixation system requiring anesthesia. For example, new pins, wires, new rings or bars. The next is 20694, removal under anesthesia of external fixation system. The next is 20696, application of a multiplanar unilateral external fixation stereotactic computer assisted adjustment, which involves spatial frame including imaging, initial and subsequent alignment assignments, computation and adjustment schedule. The next is 20697, application of multiple unilateral external fixation stereotactic computer assisted adjustment exchange, that is removal and replacement of struts each. Now let us discuss an example. A patient presents with healed fracture of left ankle. The patient was placed on OR table in supine position. After satisfactory induction of general anesthesia, the patient's left ankle was prepped and draped. Tourniquet was not positioned or utilized. A small incision about 1 centimeter long was made in the previous incision. The lower screws were removed. Another small incision was made just lateral about 1 centimeter long. Upper screws were removed and from the plate. Both wounds are thoroughly irrigated with copious amounts of antibiotic containing saline. The skin was closed in a layered fashion and sterile dressing applied. Select the appropriate code. Here he is coming for the removal of screws. So the appropriate CPT is 20680. Removal of implant deep, that is buried wire, pin, screw, metal band, nail, rod or plate. Now coming to insertion and removal of drug delivery systems. The manual preparation involves mixing and preparation of antibiotics or therapeutic agents with the carrier substance by the physician or other qualified healthcare professional during the surgical procedure, and when shaping the mixture into drug delivery device, for example beads, nails or spaces, for placement in the deep intramedullary or intra-articular space. Codes 20700, 20702 and 704 are add-on codes for manual preparation and insertion of drug delivery device during the associated primary surgical procedure listed with each add-on code. Whereas the codes 20701, 703 and 705 are add-on codes for the removal of drug delivery device during the associated primary surgical procedure listed in the parenthetical codes associated with each add-on code. Next is insertion of prefabricated drug delivery may not be reported with 20700 or 702 or 704. And report 20680 if removal of drug delivery device is performed alone. Next, report 20700, 701, 702, 3, 4 and 5 once per anatomical location. Now coming to CP2s, the first code is plus 20700, manual preparation and insertion of drug delivery devices deep. The next is also an add-on code plus 20701, removal of drug delivery device deep. The next is 20702, manual preparation and insertion of drug delivery device intramedullary. The next is plus 20703, removal of drug delivery device intramedullary. Next is also an add-on code plus 20704, manual preparation and insertion of drug delivery device intra-articular. The next is plus 20705, removal of drug delivery device intra-articular. So these are all add-on codes that must be used in conjunction with another primary procedure that is performed. For example, 20700. The procedure 20700 can be reported with various procedures such as 11010, 11011, 11012, etc. and so on. And similarly, 20701 can be reported along with 11010, 11043, 11044, like that. You can find the specific primary procedure codes which can be used in conjunction, which must be used in conjunction with these add-on codes. Now coming to replantation. Replantation refers to surgical reattachment of body part such as finger, hands or toe that has been completely cut from the body. The goal of replantation surgery is to reattach and restore function to as much as the injured part as possible. The next are replantation codes. The first CPT is 20802, replantation arm including surgical neck of humerus through elbow joint, complete amputation. The next is 20805, replantation forearm including radius and ulnar to radical carpal joint, complete amputation. The next is 20808, replantation hand including hand through metacarpopharyngeal joints, complete amputation. The next is 20816, replantation digit excluding thumb, including metacarpopharyngeal joint to insertion of flexor sublimus tendon, complete amputation. The next is 20822, replantation digit excluding thumb. The next is 20824, replantation thumb, complete amputation. The next is 20827, replantation thumb, includes distal tip to MP joint, complete amputation. The next is 20838, replantation foot, complete amputation. Now coming to grafts or implants, the codes for obtaining autogenous bone, cartilage, tendon, fasciolata grafts or bone marrow or other tissue through separate skin or facial incisions should be reported separately unless the code descriptor refers the harvesting of graft or implant. Next is autologous grafts are already defined in the CPT code set, including skin, bone, nerve, tendon, fasciolata or vessels should be reported with more specific codes for each tissue type. Code 15769 may be used for other autologous soft tissue grafts harvested by direct excision. Next, see 15771, 772, 773, 774 for autologous fat grafting harvested by liposuction technique. One more important point is do not append modifier 62 to bone graft codes, which come under the range 20900 to 20938. Modifier 62 should not be appended to bone graft codes that are in the range 20900 to 20938. Now coming to the various CPTs. First one is 20900, bone graft, any donor area, minor or small. Next is 20902, bone graft, major, any donor area, major or large. Next is 20910, bone graft, any donor area, cartilage graft, cortochondral. Next is 20912, cartilage graft, nasal septum. The next is 20920, facial lata graft by stripper. The next is 20922, facial lata graft by incision and area exposure, complex or sheet. The next is 20924, tendon grafts from a distance. Next is an add-on code plus 20930, allograft, morselized or placement of osteopromptive material for spine surgery only. Next is also an add-on code plus 20931, allograft, structural for spine surgery only. Next is plus 20932, allograft including templating, cutting, placement and internal fixation when performed, osteoarticular including articular surface and contiguous bone. Next is also an add-on code plus 20933, allograft, hemicortical intercalary partial, for example hemicylindrical. The next CPT is plus 20934, which is nothing but allograft, intercalary, complete. For example, cylindrical. The next is plus 20936, autograft for spine surgery only, includes harvesting of graft. Local, for example, ribs, spinous pauses or laminar fragments obtained from same incision. The next is plus 20937, autograft for spine surgery only, morcellized through separate skin or fascial incision. The next is plus 20938, autograft for spine surgery only, structural, bicortical or tricortical through separate skin or fascial incision. Next is plus 20939, bone marrow aspiration for bone grafting, spine surgery only through separate skin or fascial incision. We will discuss in detail about these add-on code when we talk about the spine topic in musculoskeletal system. As of now, just go through the codes. The next code are other procedures. The first CPT is 20950, monitoring of interstitial fluid pressure, including incision of device, for example, big catheter technique, needle manometer technique, in detection of muscle compartmental syndrome. Next is 20955, bone graft with microvascular anastomosis fibula. The next is 20956, bone graft with microvascular anastomosis iliac crest. The next is 20957, which includes anatomical location of bone graft with microvascular anastomosis metatarsal. The next is 20962, bone graft with microvascular anastomosis other than fibula, iliac crest or metatarsal. The next CPT is 20969. Free osteocutaneous flap with microvascular anastomosis other than iliac crest, metatarsal or grade 2. The next is 20970. Free osteocutaneous flap with microvascular anastomosis iliac crest. The next is 20972. Free osteoarticular flap with microvascular anastomosis metatarsal. The next is 20973. Free osteocutaneous flap with microvascular anastomosis grade toe with web space. The next is 20974. Electrical stimulation to ID bone healing. Non-invasive, non-operative. The next is 20975. Electric stimulation, invasive or operative. The next is 20979, low intensity ultrasound stimulation to aid bone healing, non-invasive or non-operative. The next is 20982, ablation therapy for reduction or eradication of one or more bone tumors, including adjacent soft tissue when involved by tumor extension, percutaneous, including imaging guidance when performed by radiofrequency. The next CPT is 20983, ablation therapy for reduction or eradication of one or more bone tumors by cryoablation. The next is add-on code plus 20985, which is nothing but computer assisted surgical navigation procedure for musculoskeletal procedures. Imageless. List separately in addition to code for primary procedure. And for computer assisted navigational procedures with image guidance based on preoperative or intraoperative obtained images, see 0054T to 0055T. And finally, unlisted procedure 20999, 20999, unlisted procedure musculoskeletal system general. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.